Are autism rates stabilizing? A new report by the CDC says the number of children being diagnosed with the condition has been holding steady over the last several years.
All right, joining us now, Dr. Doris Day, Clinical Associate Professor at NYU Medical Center. So that's good news. Are you buying that the rates are indeed stabilizing?
Well, on the good news front, it's always nice to hear things aren't getting worse on some levels. But what it really means is a little bit difficult to understand. So the CDC monitors autism rates, and from 2010 to 2012, in the 11 counties across the country where they're measuring rates in 8-year-olds, they don't see a difference. And that's good. But the problem is, what are they really capturing, who are they missing, and who's really getting help? So when you look at the groups getting autism, we still know that minority communities are not being diagnosed properly early enough or getting the services they need. And the rates are still alarming at 1 in 68.
Wow.
So the CDC isn't saying that this should make us feel comfortable that autism is on the decline and we should just forget about it. What they're saying is they're not seeing a change in the counties where they're measuring it, but that may be because they're diagnosing it earlier. More kids are getting in the system in some ways, but even those kids who are in the system aren't getting all the help they could be or should be getting.
Right.
So we still need to have autism awareness. We still need to understand better and look broader than just these 11 counties across the country and see what's really going on.
Because the screening isn't reaching all demographics.
Exactly.
Yeah.
All right, and Autism Speak says that they think the numbers are underestimated.
Right, I think that's true. I agree with them, and I think the CDC might agree with that too, but they have to measure something somewhere, and it's good that they're paying some attention to it. And it's always great to keep that awareness high and aim to have greater measurements across greater counties in the country.
Gotcha, indeed. All right, so with a grain of salt there for sure. All right, and a new study supports short-course antibiotic treatment for Lyme disease, but not all experts think that this is the best option.
And I'm one of those experts.
That does not think
right,
that.
Exactly. Well, this is a study out of the Netherlands that was published in the New England Journal of Medicine, which is good.
Sure.
So that's, on the surface of it, a good thing. And it's a well-done trial looking at close to 300 people. But here's a little bit of the glitch around it. So this looked at people who had a diagnosis for over 2 years. This is not someone who was just diagnosed with Lyme and determining how long to treat. These are people who've had it for a period of time or in that chronic Lyme disease phase. And in that phase, you don't know if it's still active chronic Lyme disease or if they have the destructive effects of the infection that's affecting them. So when we argue these things, all it shows us, when you look at the 3 arms of the study, there were 2 different antibiotics and one group got nothing. And the doctors just observed them over 12 weeks to see if anyone improved. And they found that there was no difference across the 3 groups, meaning that in all groups, some did better, some did the same, and some didn't do any better or did worse, right? So then all this tells me is that we need to better understand more about Lyme disease. Is it active infection? What can we measure in the blood? What other measures can we use? And is 3 months long enough? Those people may need longer treatments to see improvements. 3 months is a period of time, but it may not be long enough.
Part of what makes these studies so great is that it almost shows us what we don't know, you know?
We have to ask the right questions.
Right.
So we need to know if there's destruction, if there's active disease, what made those people get better, what didn't help the other group, and hopefully this will lead to better testing. Because, you know, the problem with Lyme disease is that it's clinical judgment on so many levels. Some people don't have active Lyme titers, which means when you take a blood test, you may not be able to measure from that what their level of Lyme is, or even if they have an infection.
Gotcha.
Some of these people don't even test positive. So it could be a problem.
Dr. Doris Day, all right, that is a big
you.
mystery. Still so many parts of that disease. All right.